Before you do CO2 laser, watch this. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. CO2 laser explained properly. What patients and clinicians must understand first. CO2 laser is one of the most effective resurfacing treatments in aesthetic medicine. But it is also one of the most aggressive. Unlike pigment lasers, CO2 laser primarily targets water within the skin. Because water is abundant in tissue, CO2 laser creates controlled thermal injury. This controlled injury stimulates collagen remodeling, skin resurfacing, texture improvement, and skin tightening. CO2 laser is commonly used for acne scars, wrinkles, sun damage, texture irregularities, and skin rejuvenation. One of the most important concepts is understanding the difference between fully ablative and fractional treatment. Traditional fully ablative CO2 removes the entire surface layer of skin. This creates dramatic results, but also significant downtime and risk. Fractional CO2 creates microscopic treatment zones, leaving surrounding skin intact. This improves healing and reduces downtime. However, fractional does not mean low risk. Complications can still occur, especially with aggressive settings. One of the most common complications is post-inflammatory hyperpigmentation, especially in darker skin types. Inflammation stimulates melanocytes. The more inflammation generated, the higher the pigmentation risk. This is why preparation creams are often used before treatment. The goal is to reduce melanocyte overactivity before laser exposure. Another major misunderstanding is social media recovery expectations. Many videos dramatically underestimate downtime. Recovery may involve redness, swelling, crusting, sensitivity, and prolonged pinkness, sometimes for weeks. Patients must understand, CO2 laser is not a lunchtime procedure. It is a true resurfacing treatment. Settings matter enormously. Power, density, passes, pulse duration, and treatment overlap all influence safety and recovery. More aggressive treatment does not always mean better treatment. Overtreatment increases risk of pigmentation, scarring, prolonged redness, and delayed healing. Patient selection is critical. Not every patient is suitable for aggressive resurfacing, especially patients with active inflammation, poor healing, recent tanning, or unrealistic expectations. Good CO2 laser treatment requires understanding skin biology, inflammation, wound healing, and long-term collagen remodeling. The best laser clinicians are usually conservative, because they understand that safe healing is part of the result. Aesthetics and Skin Institute, evidence-based education in lasers, injectables, anatomy, and aesthetic medicine. Aesthetics and Skin Institute.